Most of us probably know someone who's had a concussion. It's that tricky, invisible injury you get from a knock to the head, and we usually just expect people to get better after a little while. But what happens when they don't? Today, we're going to dive deep into the very complex and often really misunderstood world of post-concussion syndrome.
And this is really the core question, isn't it? Why do some people bounce back in a couple of weeks while others are stuck with these debilitating symptoms for months or even years? It's a huge puzzle.
Okay, so to really get what goes wrong, we first have to understand what's supposed to happen. We need to set a baseline for what a normal recovery actually looks like.
Now, this phrase right here, invisible injury, that is absolutely key. See, a concussion is a functional problem, not a structural one. Your brain tissue might look totally fine on a normal CT scan at the hospital, but the way it's communicating, the way it's functioning, that's what's been thrown into chaos by that violent jolt.
And here's the good news. For the vast majority of people, the brain is incredibly resilient. The science is pretty clear on this. About 90% of people who get a concussion will see their symptoms just go away on their own.
So a typical recovery follows a pretty predictable script. Right after the hit, you might feel dizzy, maybe a bit nauseous. Then over the next few hours or days, the headache and that frustrating brain fog can set in. But for that lucky 90%, if you get the right amount of physical and mental rest, those symptoms almost always fade completely within about 2 to 4 weeks.
But this whole explainer, it's about the other group, the ones who don't follow that script. This is where we get into the world of post-concussion syndrome, or PCS for short.
And these numbers really tell the story. We're talking about 10 to 20% of people. They've been called the walking wounded or the miserable minority because their injury is still invisible to the outside world, but their symptoms are very, very real and they just don't go away.
So you might be wondering who falls into this group. Well, some of the risks make perfect sense. A more severe impact, like what's called a double hit, that's where your head hits a second surface after the first blow, that definitely increases your risk. But what's really fascinating is that pre-existing conditions are a huge factor. If you already deal with things like migraines, ADHD, anxiety, or even seizure disorders, it's like your brain is already predisposed to have a much tougher recovery.
Now, because the injury doesn't pop up on a scan, trying to diagnose post-concussion syndrome is a massive challenge. There's no single blood test or brain image that can just say, yep, that's what this is. And get this shows just how tricky it is. Even the official medical guidebooks can't fully agree on how to define it. The ICD-10 criteria, for example, say you have to have lost consciousness to get a PCS diagnosis. But the DSM-4 says, nope, loss of consciousness isn't required. This disagreement right at the top tells you everything you need to know about how complex and debated this condition is, even among doctors. Honestly, this quote from a brain injury specialist just sums it all up perfectly. Every single brain is different, every injury is different, and the mix of symptoms that one person gets is totally unique to them. There is absolutely no one-size-fits-all when it comes to PCS. So if every case is so unique, how in the world do you treat it? Well, this is where you see all these different philosophies and approaches pop up, and they target everything from your brain's processing power to, well, some things you might not expect at all.
All right, so the first line of attack is usually therapy that's aimed at specific groups of symptoms. If you're having trouble with memory, that's cognitive therapy. If you're feeling dizzy and off balance, that's vestibular therapy, which is all about retraining your inner ear and your body's balance system. And if your vision is blurry or you can't track objects smoothly, that's where ocular therapy comes in. It's basically physical therapy for your eyes. Medication, that's usually seen as a last resort, something to try only if these other targeted therapies aren't cutting it.
But there's another, more fundamental approach that looks at the brain's incredible ability to heal itself. The whole idea is based on this concept called neuroplasticity, the idea that our brains can literally change, adapt, and build new connections to get a job done.
So how do you actually make that happen? Well, for this to work, you can think of it like a recipe that needs 4 key ingredients. First, some little piece of that damaged nerve pathway has to have survived the injury. Second, you have to do very specific, gentle exercises to activate that pathway over and over, encouraging new connections to form around the damaged area. Third, you've got to give the brain the right fuel, good nutrition and lots of oxygen. And finally, you have to get inflammation down, because inflammation is the enemy of healing tissue.
Okay, now get ready for a pretty big plot twist. We're about to look at a completely different, and some would say controversial, theory. What if the lingering symptoms of a concussion aren't really a brain problem at all?
What if the real root cause is actually a hidden injury in the neck?
There's one doctor who uses this really powerful analogy to explain the whole theory. He calls it the clogged brain toilet. Yeah, it's a vivid image for sure, but it does a great job of explaining a pretty complex mechanical idea.
So according to this model, that whiplash motion from a concussion can damage tiny ligaments in your upper neck, which creates instability. Now that instability can actually cause the jugular veins, the main drainage pipes for your brain, to get compressed. And the logic is simple. If fluid can't get out, then all the toxins and metabolic waste just build up, creating this polluted environment that leads to brain fog, headaches, and all the other PCS symptoms. So the fix, in this view, isn't to treat the brain directly. It's to treat the neck injury to, well, unclog the drain.
So no matter which recovery path someone goes down, one thing is crystal clear. A brain that's been through a major injury like this is fundamentally changed.
And this is a really tough but crucial reality to understand. Even after your symptoms get better, the brain isn't really good as new. Those original nerve pathways are still weaker. Think of it like a road that's been repaired. Yeah, it works, but maybe it has fewer lanes now, making it much more likely to get jammed up in the future. This is why second and third concussions are often so much worse.
Which leaves us with this final, really big thought. When we talk about concussions, so much of the focus is on recovery, on healing. But when you realize how much more vulnerable the brain is after an injury, maybe the most important conversation we should be having is about prevention. How do we protect our brains from that first hit, and every single one after that? It's a question that's definitely worth thinking about.